My name's Ruth Francis. I'm an enterprise coordinator at East Sussex Careers Hub based at the County Council. I'm joined today by Carly, who's here to talk to us about his role in the NHS. So welcome, Carly.
Hi, good morning. Good morning. Good to be here.
Yeah, thanks for joining us. I wonder if you could start, Carly, by just introducing yourself with your job title and giving people a bit of an idea of what's involved with that.
Okay. I am a consultant pediatric surgeon at the Children's Hospital, and my area of particular interest in pediatric surgery is pediatric urology. And I'm also the Director of Education at the Brighton and Sussex University Hospitals, which, as you probably know, is the main teaching hospital in the southeast of England.
Oh, okay. I knew it was a teaching hospital. I didn't realise it was the main one for this area. That's really interesting. And some people might not know what urology is, Carly.
Okay, urology is a branch of medicine that deals with the kidneys, your urinary bladder, your genitalia. So it deals with that parts of the body.
Sure. Okay. Wonderful. So I wonder if you could give us a little bit of an insight into earlier days, Carly. So when you were at school, how did the first interest in medicine come about?
Yeah, it's very interesting to think back and say why I became a doctor. Mm-hmm. And in fact, it isn't something that I can pinpoint and say I have an exact reason why I became a doctor. I suppose it stemmed from the fact that I like working with people. I just enjoy being, useful. I was very good at biology and chemistry and so on. So I had an interest in science. I had an interest in people. So it sort of started from that. And I suppose one of my dad's good friends was a doctor. So I've seen him working. He was a GP. So clearly that might have influenced me subconsciously. So by the time it came to my career choice and taking courses in the university and so on, I sort of knew that I could bring my interest in science and looking after people together if I became a doctor. So that's how it all started.
Okay, wonderful. So that gives us a little bit of an intro, and you very kindly have prepared us a bit of a presentation. So I'm going to put that up on the screen in just a moment. So here we are. Carly, please take us through what we have in front of us.
So this is actually an image of the Royal Alexandra Children's Hospital, and people who live in and around Brighton and Sussex probably will recognize that, because literally every family has had some child who has had to come to hospital. Not always for serious conditions. It might be just a visit as an outpatient, or it could be as an inpatient for more serious problems. So the Alex, as it's fondly called, is well known in the region, and people, the people who work here are just amazing. And it's not the building which makes the hospital, though the building looks great, but it's actually the people who make a hospital. And we're very fortunate in this part of the world that we have some really fantastic, capable, but also very considerate people who work here at the Alex.
Yeah, well said, well said. Right, and who is this delightful little cutie here?
I actually don't know who this cutie is.
Okay.
That's something, I think, a picture we got out of the internet, because this is one of the slides we use in teaching medical students at Brighton and Sussex Medical School, where in the first year and so on, people learn about what we call embryology, which is the development of the human being. So this slide actually shows on the left the actual embryo, which is coiled up and looks almost like some sort of shellfish. And from that status, we develop to become a cute little baby, as we see on the right. And it's a very fascinating study of how you know, from tiny cells, we make such a wonderful human being, and which is what we all are. And that's the fascination of becoming a doctor. It's about understanding all these little things that go to make a human being, and being fascinated by the whole thought that this process works so well time and time again. You know, most of us are what we might say completely normal, though my colleagues don't think I'm very normal, but that's a different conversation. So it's just an amazing thing that this happens so regularly. And this little cutie just represents all of us.
Yeah, wonderful. Thank you. So just out of interest, actually, on the left there, how old would that embryo be?
About, I would say, around 6 to 8 weeks.
Okay.
So really early on.
Really early on, but you can see the arms there, can't you?
Yes,
Quite
you
clearly.
can see arm buds. So you can see the little projection where the chest is, where the heart is being formed, and you can see the very top where you can see something resembling a face. Yes, already things are getting shaped. Yeah.
Excellent. Right, and here we have the face.
This actually shows how the face is developed. And so we can see, as you said, this is at 7 weeks, almost the same time as the other picture we saw. But this is an end-on view, which actually shows the beginnings of the nose, the sort of mandible or the jaw, and the mouth. So it's all getting formed as we look at it around that age. In fact, that is the thing. It's the first 12 weeks when everything is formed. After that, it's all getting bigger, but nothing new is being formed, which is why we often emphasize the importance of mothers to be very careful in the first 12 weeks, because that's when things can go wrong if you take the wrong medication, etc.
Yes, with all those cells rapidly forming and changing.
Correct. Right. Yeah.
Okay.
And this is an ultrasound scan of a mother-to-be showing the embryo. And here you can see the kidney, which is not a normal kidney actually. It is dilated. So we can often pick up a lot of these abnormalities even before a baby is born. And that helps us because we can then be prepared when the child is born to be dealing with it. And we can also use this to advise parents so that it's not a surprise when the child is born that they suddenly find something may be wrong. And we actually run what's called an antenatal counselling clinic. So parents who are expecting children with abnormalities, which may range from very minor ones to quite significant ones, where they can meet the health professionals and have a chat before the actual birth.
Yeah, so they have that knowledge to prepare them.
Absolutely, and it really helps them because, you know, I think having a baby is such a wonderful thing, but suddenly if you find there is a significant problem, it's a shock. At least here we can prepare them and also advise them, and sometimes what may appear to be a very horrendous problem, once we have explained it and they understand we can deal with it, they are more relaxed, and so it does help.
Yeah.
Oh yes, abdominal pain. I think a lot of the children who may see this video will often know of or have experienced abdominal pain, which is why I put that slide, because it's one of the commonest conditions for which children come to hospital. Now, the reassuring thing is most of abdominal pain is not significant. We all get it, and then it goes away in a day or two, and so people don't have to be usually anxious. But it's the pain that persists, and or if it is associated with things like getting sick, vomiting, then there's more cause for concern. But it can be very troublesome, and often one of the reasons why children miss school.
Not always a simple case of eating too much ice cream.
It could be. It could be.
It could be.
Yes.
And I should have prepared people for this rather grim photo, which looks like something out of a horror movie.
Yeah, this is actually an inflamed appendix. So you can see here, this structure there is an inflamed appendix, which is one of the commonest causes of having surgery for abdominal pain. And this is what is called a laparoscopic or keyhole surgery. So this is not an open operation. So this is a picture that you see when you do keyhole surgery. This is an instrument that uses an electric current to produce heat with which we can dissect and get rid of blood vessels and tissues before we can remove this appendix. So
is the appendix the kind of sort of worm-shaped thing across the top of the screen?
Yeah, it is a worm-shaped structure which is attached to the bowel, and it doesn't have any significant function, so we can safely remove it, but it can cause pain, and sometimes if the appendix ruptures, it causes a lot of infection in the abdomen. So many families will know of people who have had their appendix removed.
Yeah. I've got my cousin. That's who I'm thinking of now.
Yeah.
And I think it did get a bit late, and he did start to get a bit of it. Is it peritonitis that you get when it's, yeah. He was lucky. Let's put it that way.
Yeah. And this is just an X-ray which shows that sometimes the intestines can get obstructed because of some blockage, which can be in many cases a little bit of a twisted bowel, or sometimes it's more dangerous like a cancer, particularly in older people. And the X-ray here shows what we call a stepladder pattern of bowel loops. So that's quite typical of what we find when the bowel is obstructed. And this is another cause why somebody might need to have urgent surgery. And this is an MRI scan, which is a type of scanning of the body, and it shows the two kidneys and the two ureters or tubes that bring urine from the kidney down to the bladder. Now this side is the normal one, and here it's abnormal, and you can actually see the difference. It's because of a minor blockage in one of the tubes around here. So it's not fully blocked, but it is blocked enough to cause some stretching of that.
Okay, it does look enormous compared with the other one.
Exactly, yes.
I'm imagining that's probably quite painful for the patient, am I right?
Painful, and sometimes it requires surgery as well. Yeah. And as I said, because I'm a urologist, that's the sort of stuff I do. And this is me very recently with my sort of protection against the COVID, etc. So just to say that even in circumstances like now, when everybody is anxious, etc., nurses and doctors, we carry on working. And I think, we appreciate the fact that the public have been so supportive of doctors and nurses and other healthcare professionals. And so this is a very special type of mask, and it's connected to an air supply which is filtered, so that when we operate on patients, we don't get exposed if there is a virus around. And also it protects the patient from us. So it's both ways. And yeah, it's great that we are still carrying on doing stuff. Absolutely.
Definitely. I know we're also super grateful for that. I'm glad you're staying safe.
Yeah. So this is a little cyst in the mouth of a child. You can see that here. And it's got an interesting name. It's actually called a ranula. And it's called a ranula because this is supposed to resemble the belly of a frog. And for the biologists in the school, the word rana hexadactyla is what is used to describe the common frog. So the ranula, that's why it gets its name from that, the belly of a frog. It does look like that.
Yeah, again, quite a gruesome shot.
Yeah, it can affect speech, it can affect swallowing and chewing and so on. So which is why we remove it.
Sure.
And this is a more deforming condition called a cleft lip, or a hair lip, as people sometimes call it. So babies who are born where the lip is not fused have a gap, and it can be quite deforming and also quite psychologically upsetting because it's a very obvious abnormality. So usually it gets repaired by very good specialist teams, plastic surgeons and so on. So they can repair the palate, and many of them look completely normal now once it's repaired. But there are thousands of children around the world who can't have it repaired because they don't live in countries like the UK. So in fact, there is a charity called Smile, which goes around the world helping to repair these deformities in children. They do a lot of work, and that's another fantastic thing that you can do as a doctor or a nurse. You can get involved in charities which support healthcare around the world where there are less fortunate people, and people would have probably heard, Médecins Sans Frontières, etc. So it's really wonderful. That's another thing we all like to do.
Yeah, fantastic.
And of course, in my other role as Director of Medical Education, I'm very much involved in education, training, and research. And that's the fascination of becoming a doctor or a healthcare professional, because it's not just about the clinical or the medical work you do. You get involved in education, you get involved in training people, you can do research, as people probably now have heard. There is so much research going on about the coronavirus. So that's another important area of medicine. So if you're not somebody who likes to all the time see patients, you can still become a doctor and do plenty of good by doing research. So you get this opportunity. And
yeah, fantastic. Seems like the learning never stops when you're a doctor.
No, it never stops. It never stops. And this is one of the things which we do, which is to go and give lectures. And because when you are involved in research and education, you get the opportunity to participate in international meetings. So this is myself giving a talk. I think this was probably in China, actually. And because we have international relationships with various countries, and so you can travel, you can meet friends, make friends across the globe. And that's another fascination in the profession, because we all have similar problems, so we share our experience and learn from each other.
Yeah, that is really wonderful. I think we've all really noticed that in COVID, how scientific medical knowledge is shared across teams that really do span the entire globe.
Absolutely. And this is just part of our team. We went to China because we have an exchange program with them. So this was a few years ago, where some of us from Brighton, we went and traveled in China for about 10 days. We went to different institutions and saw the work they do and met with their medical colleagues and leaders. And we continue to have that shared program where so far we have had about 150 doctors from China who spend time in Brighton. So it's a very ongoing program, and it enriches both teams. And this is from all specialities. So we have people from HIV and sexual health, from obstetrics, gynecology. So all of us have gone and really shared our experiences. So yeah, it's an amazing thing to do.
Yeah, wonderful. Thank you very, very much. Right, I'm going to come back to you now.
Yeah.
So thank you so much, Carly, for preparing those slides. I think that gives a real sense of the breadth of the profession and also the depth as well. It seems to be both incredibly broad and also incredibly deep, which I think must be very exciting for anyone who's involved. So just kind of to sort of sum up, if you like, across all the different things that you've done, you talked a lot about all the teams that you're involved with, the all the different things that you're constantly learning. I mean, what would you say are the kind of skills and qualities that someone needs to have to really succeed in all of those things?
I think the first thing I want to say is, because I'm very passionate about it, any child in this country, if they have the aspiration and the will to work towards becoming a doctor or a nurse or a healthcare professional, they should be supported in doing so. There is no reason why in a country like ours we cannot do that. Mm-hmm. What is required is that ability to have, the willpower to work hard over a period of time, because it's not an easy route. Because of course, it's not about just being academic or being clever, because most of our students will be able to have that academic ability. It's more about having the will to work over a long period of time, because it's a long training program. The medical school itself, you will spend about 5 to 6 years, and then the training program is anywhere between 6 to 10 years, depending on the specialty you want to go into. Mm-hmm. And a lifelong learning process. So as long as you understand that, then any one of us should be able to do that. Clearly, you must have an interest in science. You must have an interest in working with people. You must have an interest definitely in working in teams, because none of what I do or my colleagues do is isolated achievement. Every bit of what we do, there are numerous people, right from, I say, the receptionists who answer phone calls, my secretaries who make appointments, the nurses, and everybody. So it's always a team effort. So you have to be a team player. So as long as you're a team player, you're interested in science, you want to work with people, then this is a career that you should look at. And it's either, you can become a doctor or a nurse. There are other groups of healthcare professionals now, like physicians associates. So we have a whole sort of gamut of things you can do. So
yeah, the NHS likes to say they have 350 different career roles. So there is definitely something for anyone, isn't there?
Absolutely. I mean, and as many people may know, the NHS is the largest employer in the Western world as a single employer. So we have opportunities for everybody. And the NHS is just an amazing organization. I mean, there's absolutely nothing like that anywhere else in the world, and we got to be proud of it.
Yeah, definitely. We are so lucky. We are so lucky to have it. That is so true. Yeah. Wonderful. So if anyone is a young person and they are thinking, what can I do now to get ready to follow you into the medical field? What sorts of things should they be trying to do at school or outside of school?
I mean, depending on their age, if they're very young, the simplest thing is to, develop an interest in the sciences, just develop the ability to speak with people. And even if they have grandparents and so on, just spend time with them so that they get into the habit of looking after people, because that's the main thing. It's about learning to care. And it's not about just fixing problems, but it's actually looking at human beings and caring for them. So they can start doing that. The older children can clearly, approach the healthcare professionals, their general practice or their nursing homes, the hospitals, to see whether they can come and have some taster weeks and so on. And actually approaching places like nursing homes and spending time with the people there is very useful. Again, it's about understanding how to care. Even working in places like charity shops, there are a lot of options where you get to work in teams, where you get to work with people, and that's what they should do. Clearly, they have to put in some serious effort in some grades.
Yes, there's no escaping that.
Yes, we can't understate the importance of making sure that you do have your academic, credibility as well. But there's no reason why you can't do that. I mean, most of our kids will have the intelligence to do that. It's more about having the encouragement and the will.
Yeah, yeah. So come back to that determination and commitment.
But then, as they say, nothing worthwhile is achieved without hard work. You know, and we've been seeing, for example, not just the COVID, but the efforts of our people during the war, which we've been seeing on TV quite a bit, including that young girl at 13 who I saw on the news about putting the 8 guns on the Spitfires instead of 4. And that's amazing. So we have that sort of track record of people really working hard and working towards a goal. So I don't think we should, you know, say we can't do anything. Most of us can.
Yeah, yeah. Fantastic. That's a wonderful message to end on. So if you'd like to find out a little bit more about going into medicine, if you look at the healthcareers.nhs.org and under explore roles, you'll there find all the different roles that you could do as a medical professional. Thank you very much indeed, Carly, for sparing the time. I find that really interesting.
Thanks
so much.
It's a pleasure. Thank you.
Thank you.